quiet today. First, I want to tell you real quick that the nurse just gave me your EKG, and it is showing that you're having a heart attack. So they're going to be working on things and getting some IVs and stuff done. We're going to do a real quick interview here and get an exam going. I've already called the cardiac cath lab. You will have to go for a catheterization.
Okay.
So tell me, excuse me, real quickly, what happened this morning? What you experienced?
I was shoveling the snow just since we got a lot last night, and then I just got really hot and started sweating a lot. So I started taking off some layers, and it didn't help. And then I got really nauseated, and then I got this like sudden pain like in the center of my chest. It was really sharp and just kind of knocked me out. So.
I think I saw you have what, high blood pressure, diabetes, cholesterol, all of those?
Yeah, and I take medications for those.
Okay, can you tell me what you take?
I take like a statin and an ACE inhibitor and other things. I have it all in daily.
Have you had any aspirin?
No, I didn't. I just came right into the hospital.
Okay, that's my scribe over there, by the way. They're just taking notes. I'm going to tell them periodically a couple things. If you could put in an order for 4 chewable aspirin. You are having pain right now?
Yeah, I did take a nitro on the way in.
Are you still having pain?
Yeah.
So go ahead and put in for nitro 0.4 sublingual and also a nitro drip. Okay, go ahead. So that was about how long ago that this happened? An hour ago? Or
I think just like 30 minutes ago.
30 minutes ago. And then did you call 911 right away?
My wife was out. My husband was outside, so I just came right in.
Okay. And then, so they brought you in here, and where's your pain at right now in terms of 1 to 10?
I'd say 10 really hurts.
10, okay.
Yeah, and it radiates. It goes right into like my shoulder and then just kind of like all the way up through my neck and jaw and just.
Okay.
Yeah.
Okay, so your blood pressure is looking okay. So if you could put in for 4 milligrams of morphine IV as well, we'll try to get you a little bit of relief. Are you still nauseated too?
Yeah.
And 4 of Zofran. Okay, let's go ahead and ask just real quickly a few other things. Have you noticed recently that your legs have been swollen? Have you had any abdominal issues?
No, not really. My legs haven't been more swollen than normal.
Okay, and anything else that's been different lately? Have you had little twinges of pain recently? You are not really.
I think I have noticed some of that, like when I go to bed after, like, going on a nightly walk with my dog, I will notice like a little bit of pain, but once I rest and take my normal medication,
so it seems to be
away.
Exertional when you're doing something more than other times. Okay. I saw in your history you've had some old heart problems. Can you tell me about those real quickly?
Yeah. So I go to a cardiologist, Dr. Khan, and I haven't had a heart attack, but I just have a long history of chest pain. And
did I see something about a couple stents being placed?
Yeah.
When was that?
2 years ago I had one in like my right coronary artery, I think. So I had that, and then I had a stress test 1 year ago, maybe 1.5 years ago.
Okay. Anything else I haven't asked that you think that's important? Otherwise I'm going to get right into the physical exam.
No, I think I'm.
Okay. All right. Let's take a look at you. Open your mouth. Turn your head. There's JVD halfway up the neck. And go ahead and sit forward for me. Some deep breaths. Again. One more. Any soreness in here. Rowels at the bases bilaterally.
The pain does go into my back a little bit.
It does. Okay.
Yeah.
Turn your head. And hold your breath. And turn your head this way. Hold your breath. No carotid bruits. We have a 2/6 systolic ejection murmur and an S3 gallop. Any tenderness? Okay. Liver margin palpable at the right costal margin. No tenderness there. And nothing back here in the kidneys. All right. Let's see. 2+ pitting edema at the ankles. Okay. We will be getting a few things ready. You'll be getting your medications. I'm going to go talk to the
Okay.
And we'll be putting in some orders for some extra medications, whatever they want us to be putting in. We'll go ahead and get that done. Okay?
Okay.
Okay, got all the labs back pretty much, and cath lab's almost ready. They'll be coming to get you any minute. And how's your pain right now?
It's much better.
Okay.
Probably
good.
at like a 2 or 3 now.
Great. If we need to give you a little bit more medication, we always can. Right now, I'm just going to kind of talk to my scribe here, get a couple things in the chart for you. You want to go ahead and pull up the template for the EKG. When you're ready, go ahead.
Rate,
Rate is 100.
rhythm,
Normal sinus with occasional PVCs.
axis,
Axis is right axis.
ectopy,
There are unifocal PVCs.
conduction,
Conduction, first degree AV block.
P waves,
And with conduction, if it's an incomplete right bundle branch block, that's probably in there too. What's next?
P waves,
P waves appear normal.
Q waves,
No Q waves.
ST wave changes,
ST segment elevation in V2 through V5, and reciprocal ST depression in 2, 3, and AVF.
comparison,
Old EKG does not show any ST segment changes.
clinical impression,
Acute anterior wall MI with a borderline tachycardia and an incomplete right bundle branch block and occasional unifocal PVCs.